So good morning everyone. आज जो नया टॉपिक है which is about your menstruation. So we will first do the multiple choice questions. ठीक है? So without wasting any time, let's start about the questions. Let's see. A 26-year-old woman gave birth to a child 6 month age ago. Okay. Now she present to a gynecologist with complaint of absence of menstruation. The child is breastfed. On vaginal examination, the uterus is normal. Dense consistency. What is the most probable diagnosis? Is it physiological amenorrhea, pseudoamenorrhea, gestation, Asherman syndrome, or the Sheehan syndrome? Okay, I'm just giving you only 2 seconds. Can you just type your answer in the chat box? Okay. So let's move, go into the one after the another. So if you see the reasoning, if you see the question, it is written as a 26-year-old woman delivered a child in the 6 month ago. Okay. And she is present to the gynecologist and the child is breastfed. Okay. So that means it is a lactating mother. Okay. It's lactation. So during the breastfeeding, we know that in the time of the breastfeeding, that means there is an increase of the prolactin level in the body. Whenever there is an prolactin level increases, it releases the gonadotropin, it decreases the release of the gonadotropin hormone. That means there is a decrease of follicle stimulating hormone and the luteinizing hormone. Okay. So if the FSH-LH release decreases, that means ovulation is suppressed. And now this person is suffer from the amenorrhea. So, okay. So the answer will be the psychological amenorrhea, because in the lactating mother, when the prolactin level increases, it normally reduces the uh, FSH and the LH level. It decreases the secretion of the FSH and the LH level, and the person suffer, or the person complain of, or it's a normal that there is an amenorrhea. Okay. So the answer will be your psychological amenorrhea. So why not other options? So let's do with the pseudoamenorrhea. So in the pseudoamenorrhea, what happened there? That is every month there is an flowing is there. Okay, so every month menses is there, but it does not comes out. Pseudo means that is false. Okay, so it is mostly due to the outflow obstructions. It is mostly due to the outflow obstruction. Okay, so for example, the most common is your imperforated hymen, which is another name is a cryptomenorrhea. So because of there is an outflow is obstruction is there, so blood is usually accumulated. So what you will see, the uterus is enlarged due to the retained blood. So here uterus is enlarged due to retained blood, which is known as a hematometra. But here in the question, the uterus is normal. Okay, the uterus is normal form and dense consistency. Okay, so there is no question of pseudoamenorrhea. So now the gestation, that is in the question, there is a no sign of gestation. Okay, what is mentioned is that the child is breastfed and the uterus is normal. During the gestation period, the uterus enlarges. Okay, so obviously gestation will not be the answer. She now come to the Sheehan syndrome. So why not the Sheehan syndrome? Okay, let's go with the first the Asherman syndrome. Okay, the Asherman syndrome. The Asherman syndrome is usually it is a post-curettage complication. Okay, the post-curettage complications. So here the uterus is small or it is scarred. Okay, here the uterus is small or there is a scar formation. Okay, so here the uterus is not normal, but what you will see in the question, the uterus is normal with dense consistency. Okay, now what do you mean by the Sheehan syndrome? Why not the it is your Sheehan syndrome? So in the Sheehan syndrome is usually occurred after the postpartum hemorrhage. Okay, so we will tell in my next video about the detail about the Sheehan syndrome with your mnemonic. So let's start it here first. So Sheehan syndrome is most common cause if there is a postpartum hemorrhage. Okay, now after the postpartum hemorrhage there is a failure of lactation. Okay, failure of lactation because the pituitary gland, because of the lack of the blood supply in the pituitary, it become atrophy. Okay, so there will be a failure of lactation, no prolactin hormone releases from the pituitary gland, so failure of lactation. And also there is another features here in the question. What is that? The patient, that the person, the old woman is breastfeeding. Okay, so this condition is also ruled out. So the more common will be the, that is the most correct answer is your psychological amenorrhea. Okay, so if you have any question you can drop me in the chat box. So let's, so in the another class, in the next topic, we will discuss about your Asherman syndrome and also the Sheehan syndrome, okay, with its mnemonic and everything.